Great. All right. I think it's recording now. So, does everyone know how to use the chat box? If you do, go in there and type yes for me.
I hear it.
If you know how to use the chat box, go in there and type yes for me. Awesome. Awesome, awesome, awesome. So you guys are familiar with the chat box. First time, huh? Patricia, really? Lelaine, hey Lelaine. Great, great. All right.
Chat box or first time for Zoom?
Doctor, I don't have a chat box. How do I get it?
Okay, you don't have a chat box? So on the bottom of your screen, you should see a few different boxes, and one of the boxes says chat. Do you see that?
Oh, I see. Okay, got it, got it.
Yeah, click on that.
Okay.
All right. Is there anyone who don't know how to use the chat box?
Me. I don't see a chat box.
You don't see a chat box?
No, I can't even find it. There's nothing on the bottom of my screen.
Really?
Phone?
Okay.
So I see a red record button on the top.
Okay. Don't worry. If you don't know how
I
to
don't
use
have anything to say. I'll be quiet.
yeah, if you don't know how to use the chat box, just go in the chat box and say, I don't know how to use it.
I don't know where the chat box is.
If you see the
right
three dots, there's
your
three
iPad,
dots.
the
Click on the three
button that
dots.
says more. It says
that.
more.
Oh, click on the dots that say more.
Yeah, it says more.
Bottom right.
Jerry
Oh,
Chesney
Okay,
is
got
here.
it.
Nurse
Oh,
Jerry.
got it. Okay.
Is it okay if my name is not listed on this list?
Yes, it's okay.
Okay,
You're
So
you're here. So
so I can just click on everyone and then I can type what I want.
yes, then I'll see it as I'm chatting. Virginia says, move your cursor over to the black portion of the bottom of your screen and then do something with it. I don't know.
Well, then things will pop up down
That's
there.
right.
Three dots and says more, tap it.
Yes.
I'm Priska. I don't know how to use a chat box.
That's okay.
I'll just listen. I'll just listen.
So I got this thing here. I don't know how to use it, but let me see. Does
looks
it
like a
sound any
hairdryer.
better?
Don't blast our ears now. No.
Does it sound any better by speaking here?
Sounds
No.
same.
Oh, okay.
But it looks impressive.
It looks
I can do
impressive.
well.
Okay. Hold
I
on.
thought it was a hairdryer.
Hold on. I'm gonna unhook this and see if you can tell a difference. Okay. Can you tell a difference?
No, not
No.
really.
It's
I
actually,
hear you well.
it's actually better.
It's clearer. There's less background noise or less echo.
Oh, so get rid of this is what you're saying.
Yes.
About the same, but whatever.
So Jenica, this is how professional we get. We're like whatever.
Looks like a
Feel better
hairdryer.
because I'll probably not be quite so on top of the tech as you are.
Looks like a blow dryer.
Like a blow dryer. Really?
Mhm.
Somebody gave me that. Somebody gave me that to so I can like sound louder when I'm on Zoom, but I don't know how to use it. So anyway, that's not good for an Asian who doesn't know technology.
You know,
Join my club.
I'm too Americanized, right? So, all right, should we get started? I think there's few folks still trying to get in, but we should get going here. I got everything. Let me see. It's recording. Good. So I will send you. I'll make this into a YouTube video, and I'll send it to you guys as well. And
You know,
let's see here. Now, let's do
You-
this.
at dinner.
Go ahead and mute yourself.
I'm gonna mute myself.
Go ahead and mute yourself. Wayne found how to chat. Thank you, Wayne. Everyone knows how to mute themselves?
no.
Nope.
Click that red microphone on the bottom.
It's somewhere it says mute. Where does it say mute?
Oh,
Oh.
yeah, mute.
Oh, there it is.
Yeah. Look for the mute button and then click on it to mute yourself.
You can also mute everybody as the host.
Oh, where do I mute everyone?
If you go to participants, I think you can mute people.
Let me see. Okay, I'm at participants. Oh, mute all. Cool. I've only been doing Zoom since March. Oh, wow. I muted everyone and it's so silent. Holy moly. So we can chat now as well in the chat box. If you have questions or, concerns or comments, feel free to chat in the chat box. What I'm going to do now is such power, Zoom power. I wish I had that Zoom power yesterday when it won't let me in to my own chat room. All right. I will email everyone I got here. Let's see. Billy, no worry. I will email the Zoom link to everybody. And what I'll do is I'll put myself on screen here. All right. Do you guys see me better now with that? Cool. So Billy says, I may leave for dinner soon. What are you eating, Billy? Just kidding. It's somehow turned really cold really fast today. I don't know why. Billy says
You guys
pork
out in
chop.
California can't complain about the weather. Over here in Boston, I think we've got you by a few degrees.
Really? What's your temperature out there?
Today it actually was 70, but before this it was, we were hitting under 50s, so.
Wow, crazy. Yes, I had under 50 probably, I had about 30 degree like 2 weekends ago when we were out in the San Bernardino Mountains and a 3-day wilderness survival course where we had to make our own tents. Not really tents, we had to make our own shelters actually from like the leaves and the tree branches and all that. And they taught us how to make fire and all these different things from scratch and identify food and from the trees and the plants that were around. It was really neat, guys, with that. Not that I believe that the world's ending, but anyway, Jenny signed me up. Just kidding. All right. Now, how many of you guys have been reading about this second wave of COVID? If you've heard about this second wave, type in yes. If you've heard about the second wave. So I think I read somewhere, it was today, that it was either yesterday or the day before, we had over 100,000 new cases of coronavirus in one day in the US. Vicky says yes, but still deniers. Heard about it, did not read anything about it. Yes, we are. I've been keeping up with the news. And Dorothy, yes, in Texas. Are you in Texas, Dorothy? Yeah, there are certain states that are being hit much harder than, by the way, where are you guys all at? What city or state are you from, or country? I'm curious. Type in what city, state, or country you're from. I'm curious where everybody is. Tina Lee's in Boston, San Clemente, Seal Beach, Los Angeles, Laguna, New Mexico, Irvine, Newport Beach, Mission Viejo, San Jose, Lake. Okay. Anyone not in California? San Antonio, Texas. Okay. Anyone not in California? What other state are here, or countries? Tustin, Maine. Okay. That's why you're having lobster, Billy. North Carolina, Sue's from North Carolina, Arizona, Diana's from Mars, Estella's from New York. Very cool. And Virginia says, your COVID lecture on viral load helped me to decide not to go to my son for Thanksgiving. Oh no, I ruined your Thanksgiving, Virginia. I didn't mean to. Oh my gosh. Albuquerque, New Mexico. Got it. So, how many of you guys have not heard about viral load yet? How many of you guys have not heard about the term viral load yet? If you have not heard about viral load, type in not heard. I need to teach you about viral load when it comes to COVID. If you haven't heard. Okay, it's a good number. Yeah, I've not heard about viral load. There is a good number of you here that have not heard about viral load. All right, let me update you because I think this is really important, this terminology, because we've all know about the mask and the social distancing and the hand washing and everything else, right? That's not anything new for any of us. But not many of us have heard about viral load. So first of all, I'm going to take a picture of you guys. Smile. So viral load is defined by the amount of virus that's in your system, in your blood, right? So for example, in HIV, when we treat patients with HIV, we check their blood to check the viral load of HIV. How much HIV viruses is in the blood, right? That's viral load. If you have, let's say, if I'm treating hepatitis C and I put patients on hepatitis C medications, what I would do is I would check their blood work and I would check to see how much viral load of hepatitis C is in there. How much quantity of virus, the amount of virus in your system is called viral load. If I'm treating, what else? If I'm treating hepatitis B, I can check for the viral load as well. So it's really measuring the amount of virus that's in our body. And that can be measured on a blood test. Does that make sense so far, guys? Type in yes if that makes sense. Viral load, if that makes sense to you. Type in yes if that makes sense. Cool. And the reason I mentioned that is this. There's more data coming out now about viral load when it comes to coronavirus. And what that means is how much exposure of coronavirus you have, the quantity, the number of virus that is coming at you, or the number of virus that's in your blood, okay? Viral load for coronavirus. And what we have found out is this, and really interesting stuff. What we have found out is that patients who have been identified with coronavirus, if they have a high viral load, they tend to be sicker. These are the ones who are hospitalized and in the ICU. High viral load for coronavirus, meaning high quantity of virus, right? Coronavirus, they tend to be sicker patients. We have also seen that if you have a low viral load, meaning you don't have a lot of virus that's detectable in your blood, then you tend to have a more mild case of coronavirus. Or oftentimes, you may be asymptomatic, where you have the virus, but you don't have any symptoms. This is when you have a low viral load in your system. Is that making sense so far? The more virus in the system, the sicker you get. And the less virus in the system, as far as viral load, the less sick you get. Does that make sense to you guys? Simple, right? Just viral load is what it is. And by the way, we can measure viral load in the blood test. It's something that is checked, especially in clinical research. Betty says, does age change that viral load? Well, patients who are sicker have a higher viral load, is what we know. It's not necessarily age related. Of course, those who are older with chronic medical conditions tend to have a lower immune system. And with a lower immune system, the virus basically takes advantage of whatever weakness you have in your body, right? And grows. So there is a correlation in a sense that if you have a weak immune system, then that virus is going to divide fast, right? Jerry Justice says it replicates from lower to higher viral load. Yes, it can divide from lower to higher, depending on how strong your immune system is, how capable your immune system is to fight the virus. And if you're immune suppressed in some way, then the virus takes hold and replicates. Whereas if you're young and healthy, or if you're just healthy in general, and you have a low viral load, then your immune system can beat it up. Now, what is the significance of viral load from a practical perspective? Well, this is a significance. I need to find a mask. I need to find a mask. Scratch and get me a mask. How many of you guys here? Kathleen, do you have a mask with you, like a face mask next to you? Anyone have a face mask with them? Jenica, do you have a face mask next to you? All right. Cool. Jenica's getting a face mask. Or Tina's getting a face mask. All right. Awesome, Tina. So, Tina, wearing that face mask, are you protecting yourself from like a computer virus so that, you know, your computer doesn't get a virus? All right, great. So Jenica's got a mask. Tina's. So
That's
So
got
let's
the
do-
basic surgical mask, not the N95. That's in my
that's
car.
fine. It looks great. So pretend that Jenica and I, and let me see if I can pin, I wonder if we can pin several people on video at once. I'm not sure we can do that. Add spotlight. Okay. Oh, cool. Yay. Okay, you guys can see me and Jenica, right? Type in yes if you can see both myself and Jenica on the screen. Type in yes if you can see both of us. Okay, Bernard. Okay, all right, you got lots of yes, so you guys figure it out. So let me teach you something about viral load. Okay, good. Okay, Jenica, you don't need to put your mask on, just keep it down. So Jenica and I are having a conversation, and we're not 6 feet apart. So we're like, you know, a feet from our computer, and pretend the computer isn't in front of us. We're just in front of each other, and we're just chatting, and Jenica happens to have COVID, right? This is just a practice thing. She doesn't really have it, right? Sorry. So as we're chatting, so pretend you're coughing at me, Jenica, as we're chatting. So what's going on, Jenica? I can't hear you. Are you talking?
Hey, how's it going? Feeling pretty crummy over here.
Really? So cough a little bit at me. Oh, that's too nice, man. So Jenica is coughing at me without a mask, and we're not 6 feet apart. How much of that viral load from her did I get? How much of Jenica's viral load did I get, guys? Type in the computer. How much of Jenica's viral load did I get as we are talking?
100%.
All of it.
50? A lot, right? I'm basically getting all of whatever, right? Quite a bit. And I want you to mention that. I want to say that because the more viral load we are exposed to, the sicker we can become, right? Does that make sense to you guys so far? The more viral load we are exposed to, the sicker we can become, right? So let's have a conversation now, Jenica. And this time I'm wearing a mask and you're not. So what's going on, Jenica? What's going on?
Still feeling pretty crummy.
Oh
I
yeah?
don't know what's going on. I should probably go get a COVID test.
Should probably go get a COVID test, huh? Okay. Oh, okay. All right. So let me ask you guys this. How much of Jenica's viral load got into my system through my nose or my mouth when I have this on? More or less? It makes sense, right? It makes sense, doesn't it? That's right, less, because the virus is in the droplets, right? It's in the little sputum droplets and stuff like that. So if she's coughing and the sputum droplets hit this, it means it's not getting into here, right? A little bit less. So I'm somewhat protected from this mask. You know, maybe
It's
not
like
100%,
70%,
right? But it's definitely less.
70.
Okay, Jenica, wear your mask now.
If you're the one wearing the mask.
That's right. Go ahead and put your mask on, Jenica. All right, let's chat now. How you doing?
Still feeling pretty terrible.
Really?
Yeah, yeah, I think I'm gonna go get that COVID test now.
Yeah. All right, guys. How much of Jenica's viral load has gotten to me now? More or less. Right? I'm getting these 20%, 25%. I love it. Right? Do you see the importance of viral load and mask? It's not really an argument, you know, is mask gonna help, not help, you know? I'm talking about viral load. How much of that virus, right, is getting to you? It may not be 100%, right? It may not be 100% protection, but this cuts down viral load. And there is an association between how much viral load you have and how sick you get. Does that make sense, guys? Right? Now you understand about viral load. And it's just simple. It's not anything complex, but we are studying viral load as far as those who are sick, as far as those who are asymptomatic, those who don't have a lot of infection symptoms. You know, they have like a mild cold with COVID and things of that sort. And we have, I think the CDC said at least 40%, maybe up to 40% of coronavirus infections are asymptomatic in general. And maybe that 40% or higher, maybe it's because we are wearing this and getting only a little bit of viral load, right? Maybe there's so many asymptomatic people who are infected. Maybe it's because of this, cutting down the viral load exposure. Because if you only get a small amount into you, a small amount, your immune system gets to beat it up. If you get the full infection, right, it's harder for your immune system to overcome the exposure to coronavirus. Sue says, not only do we protect ourselves, we protect those around us. Yes. Elaine says, important not to touch outside the mask. Yes. Elizabeth says, so if I only get 1,000 viral load, I won't get sick, or I won't get as sick. Well, I'm not sure what the cutoff is, Elizabeth, as far as, you know, a number that makes you sicker than not. But I do know that the less viral load you have, you know, that you're exposed to, the better it is, right? I don't have a specific number with that. So I want to explain that to you guys. So now here's something else that's really neat that I'm learning as well. Elizabeth says, is a big sneeze worse than a cough? Elizabeth, why don't you try sneezing versus coughing and see what happens? And yeah, I'm not quite sure with that, right? Thank you, Jenica. We're gonna have Jenica do some lectures in the future here with us with that. But whether you're sneezing or coughing, the whole idea is to decrease your viral load. And so you can do this, or a face shield, right? A face shield in front of you will also help with that. Jerry Jesse says, does vitamin D protect somebody versus a low? Yes. We're gonna talk about all that, guys, on nutrition here. There's one more thing I need to teach you guys if you don't already know it. Isabel says, should the non-medical mask be used only once, or can you use it several times a day? What is a non-medical mask? Are you talking about this? This is a 3-ply surgical mask here. It's got 3-ply means it's got 3 layers. So a 3-layer surgical mask, guys, is going to be better than a 1-layer mask or a cloth mask, right? The best mask is that N95 mask with that. Clemmy says, I sneeze a tear in my retina, so I guess it could be. Okay. Elaine says, how long does a viral load last? The viral load, Elaine, is really, it's going to be in your system until your immune system clears coronavirus. Then it goes away. When your immune system beats up coronavirus and you have recovered, then the viral load goes to 0. Makes sense? When you are recovered and your immune system kills coronavirus and you create antibodies, the viral load goes to 0, right? Unless it overwhelms you with that. Vicky says, I see people often wearing masks over their mouth, but not their nose. Isn't their nose the most susceptible? Both the nose and the mouth is susceptible to the virus. So this does not work, guys. This does not work because exposure to viral load, right?
Yeah, I was actually just at a conference where they were talking about how one of the main modes of infection is actually directly through the olfactory nerves. So if you're leaving your nose out, that means that you are way more susceptible. So they say that wearing masks is more for other people, but it is also for yourself, as long as it's over your nose.
That's right. Exactly, with that. What about lined cloth masks? Have you guys seen these cloth masks just made out of cloth? These are good also, and these are washable. These are washable with that. So I like these as well, except I like my Walking Dead mask a little bit more than the pink one here. Where's my Walking Dead mask? It's sitting around somewhere. I got a Walking Dead mask, but anyway. Now, let's
Doctor,
talk-
I have those blue masks and I wash and rewash them. I typed it up. Does that lessen its efficacy?
Not necessarily. These cloth ones? Yeah.
No, the blue ones. That I showed you.
Oh, these ones?
Yeah.
Oh, yeah. You don't wash these. These you throw in the trash.
Oh, okay.
Have you been washing this, Tina? No.
And reusing it.
This is trash, Tina.
Okay.
Yeah, this is trash. Yeah.
Gotcha.
Here's my Walking Dead mask. This is like the best, and it goes along with my Walking Dead. I had a Walking Dead blanket somewhere around here, but anyway, out of sake of time, I won't find it. But you can insert a coffee filter. Yes, you can insert a coffee filter in there, and that helps as well. Christina says, is a copper mask good for killing virus? So Christina, a mask that's made out of copper? What does that mean? Like like copper fibers? Okay. Copper wire material. I haven't seen that. That's interesting.
So they've impregnated some of the fibers now with like copper thread strands. Like they have compression stockings with copper. And I have seen some of the copper or silver infused masks. It can be done.
Yes, it's supposed to be supposed to have antiviral properties. I would say, guys, that having a mask is better than no mask for sure. Get a 3-ply at least. You can insert a paper towel as well as a filter. I've seen paper towels being inserted, and that's also okay. Now, I want to chat a little bit about how coronavirus kills. Does anyone know how coronavirus kills a patient? Type in the chat box if you know how coronavirus kills. Does anyone know? So Virginia says fills up the lung with fluid, inflammation, lungs, inflammation. You don't get enough oxygen. Rosemary, lungs, cirrhosis. Cirrhosis of the lungs? What? I thought cirrhosis is a liver thing.
Liver, right?
Inflammation. Got it. Okay, okay. Yes, you guys are up to date. Pneumonia. So I am in the ER every week admitting patients, guys. Holy moly, still people coming right now. Let me admit some more. I'm in the ER every week admitting patients. My last ER shift a few days ago, I admitted 5 patients and 2 of them were COVID patients. The most common reason we admit patients with COVID to the hospital is for a condition called COVID pneumonia. There's more folks coming on. COVID pneumonia. And let me tell you this, which is very interesting. And I'm gonna go through some research with you guys. The virus does not kill you. What kills you is your immune system's response to the virus, and an abnormal response to the virus that kills you. Have you ever heard of the words cytokine storm? Yes, Ruth, you got it. What does that mean to you, cytokine storm? What does that mean to you?
Can you type it, doctor?
Yeah, I'll type it out. Cytokine storm. Cytokine storm is simply an abnormal, overreactive inflammation reaction. How many of you guys have had, how many of you guys have sprained your ankles before? Anyone here
What?
sprained their ankle before? What happens, guys? What happens in the first 5 minutes of that sprained ankle?
Swells.
Swells? Okay, what else? What happens? Fluid rushes in, swelling,
Painful.
Pain.
pain, right? Hot, heat. First 5 minutes, right, of a sprained ankle. Why is that? Why do you get that reaction to a sprained ankle? Does anyone know? That's correct. What happens is this. Whenever the immune system detect an injury to an area, like a sprained ankle, the immune system rushes to that area and it tries to protect the area by fighting whatever may be there. Like, let's say you had you stepped on a nail or you had a cut in your arm, right? The first 5 to 10 minutes in that area of injury, you know, if you stepped on a nail or you get a cut, the first 5 to 10 minutes is where you get swelling, pain, redness, heat, right? One big ball of swelling and it turns colors, right? Everyone's had that before, right? A big ball of color that goes there. That's simply your immune system going there to protect itself from any area that's injured or toxins or bacteria or viruses that shouldn't be there. And so as the immune system is fighting, whatever should not be there, right? Like a laceration or a cut, the byproduct of this fight with the immune system is inflammation. Inflammation is the byproduct of the battle. Does that make sense so far, guys? Inflammation is the byproduct of the battle. Type in yes if that makes sense. Anytime the immune system is fighting something, you get inflammation. And that inflammation is the redness, the swelling, right? The fluid collection that occurs in the area of injury, right? Now, I want you to visually imagine something. We're gonna go do a little visualization thing. I want you to just visualize that ball of inflammation that's in your ankle. Can everyone kind of visualize that? that ball of inflammation that's in your ankle, the swelling, the heat, the redness, right? Now I want you to take that entire ball of inflammation and move it from your ankle, move that ball of inflammation from your ankle and put it inside your lungs.
Not good.
Not good, right? That's COVID.
Oh.
That's COVID pneumonia. Your immune system detects the COVID virus that got into your nose or your mouth because you got that viral load, right, from somebody. It goes to your nose, your mouth. The virus goes into your lungs. The immune system identifies and detects the virus. It's like, what is this? And it rushes in to fight the virus. As it rushes in to fight the virus, what is created during the fight, guys? Inflammation.
Inflammation.
That's correct. That's correct. So when you have a ball of fluid and debris in your lungs, we call that pneumonia. We call that COVID-induced pneumonia. Does that make sense so far? This is the number one reason why we admit patients to the hospital with COVID. It's all that fluid. And if you got fluid of inflammation in your lungs, do you think your lung cells can exchange oxygen when you got all that inflammation in your lungs?
No.
Right? Your lung cells is drowning. Your lung cells is drowning. And if your lung cells are drowning and you can't breathe, what is the symptom of COVID? I can't breathe, right? Shortness of breath. And you have shortness of breath because your lung cells is drowning in inflammation fluid as the immune system is trying to fight the virus. That's right, cough, shortness of breath, fever, right? And if your lung cells, and if you can't breathe because you got all this fluid in your lungs, what happens to your oxygen level when they check your oxygen? That's right. Right? Oxygen level goes down. The number one reason we admit patients to the hospital is their oxygen level drops below a healthy number, right? Below 90%. And then as their oxygen level continues to drop because their lungs is flooded with COVID fluid, right? As their oxygen level continues to drop, then we have to transfer them to the ICU. And as our patient continues to try to breathe all the time unsuccessfully, right? That's when we intubate our patients. And that's how patients die. Do you understand now how COVID kills? Does this make sense? Right? It has nothing to do with, anything else. There's no politics involved. This is just science, guys. This is just viral load, right? It's just viral load and inflammation. That's all it is with this pandemic. This is why, right? This is so important, right? Especially the Walking Dead one. It's even more important. But this is why it's so important, guys, with that. Okay? Now, if you know that inflammation plays a huge role in fighting COVID or in defeating COVID, then do you realize that there are ways that you can decrease inflammation in your body? How can you decrease inflammation in your body, guys?
What you eat. Eat the right food.
That's right. There are foods that are anti-inflammatory, aren't there? There are lifestyles that are anti-inflammatory lifestyles. There are health conditions that create inflammation, and there are health lifestyle that lowers inflammation. Because if you have baseline inflammation already, right? If your lifestyle shows a lifestyle that has baseline inflammation already, and you throw more inflammation on top of that through a COVID infection, is your prognosis better or worse?
Worse.
That's right, your prognosis is going to be worse. Diabetes is a pro-inflammatory condition. Did you know that obesity is simply an inflammatory condition? Right? Oh, there's more people coming in. Oh, what the heck? Right? Did you know that obesity is an inflammatory condition? This is why, right, being overweight is a risk factor for a poor prognosis for COVID, as well as diabetes, as well as other health conditions that increases your risk, right? Anything that increases your baseline inflammation is going to increase that risk of how you do when you get COVID. Does that make sense to you guys? Type in yes if that makes sense. Right? Right? Anything that increases your baseline inflammation is going to increase your risk for COVID when you get it. And the scary thing is 2 out of 3 Americans are, overweight. 2 out of 3 of us. 2 out of 3 of us in the United States have either diabetes or pre-diabetes. 2 out of 3, right? And these are all risk factors. And I wonder sometimes, maybe that's why the death rate is so high in the United States, because we all walk around with this, underlying inflammation status already, right? We're all kind of inflamed already. All right. Do you guys know, for those of you who live in Orange County, do you guys know where you can get free, no-cost COVID testing?
No,
You don't? Is Nargis here?
no, I don't know.
All right.
Yes, I'm here.
You are?
Yes, I am.
Hey, Nargis.
Hi.
Welcome.
Oh, thank you.
So Nargis works for an organization called 360 Clinic. Yes, and 360 Clinic runs drive-through COVID testing at the Orange County Fairground and also the Anaheim Convention Center.
Correct.
And you can get it at no cost. Nargis, can you put in the link where they can RSVP? You need to RSVP online.
Sure.
And Nargis will post it online. And you guys can just take down the link. It's a 360 Clinic. There's no cost to it. It's amazing. I've sent lots of patients there, and I sent family members there to get COVID testing when they need to. And it's drive-through, so you don't even have to get out of your car with that. So that's where you can get COVID testing, those 2 locations. And there it is, 360clinic.md. So take that down, 360clinic.md is where you can register.
We have
Virginia?
2 super sites, and also Anaheim City Hall has a mobile site now for people who live in Anaheim.
Perfect. If you live in Anaheim, Anaheim City Hall has a mobile, no-cost test site. I think Irvine has a site also. I don't know who runs that, Virginia. And I'm not sure down south who offers that as well.
I think it's Hoag Hospital there on, I forgot the name of the street, but where they have all the buildings. I've seen a truck out there when I was visiting, and they were giving the test.
Awesome. Okay, off of Sand Canyon.
Yeah, that's it.
Yes. Okay, so that's where, that's as south as you can get there. Thanks, Elaine. So guys, let's go over something that I am passionate about, because I believe that your food should be your medicine. Let's go over a list of 13 food items that lowers inflammation. Does that sound good? Does everyone have a pen and paper? Something to write on? Holy moly. Hold on, there's more people coming on here. All right. So let me let's go over 13 items. And these 13 items has data and research behind it that I will send you some info as well on that. Number 1, berries. Berries. That could be blackberries, blueberries, strawberries, raspberries, all types of berries, guys. Berries provide a type of antioxidant called anthocyanins, and I'll spell it out for you guys here. Anthocyanins. These compounds will reduce inflammation in your system. It'll also help boost immunity as well. Okay, number 1 is berries. Virginia says can't have berries due to diverticulitis. Okay, Virginia, then you got 12 other things you can eat. Okay, I'm gonna give you 13. Number 2 is fish, especially fatty fish. Fatty fish has omega-3 fatty acid. Omega-3 fatty acid is a strong antioxidant. And anything, guys, that is an antioxidant has anti-inflammatory effects. Okay, so that's salmon or sardines or mackerel, anchovies, things of that sort. Fatty fish. Okay. Number 3, cruciferous vegetables. What does cruciferous mean? Anyone know?
The root grows from the root, like broccoli. Is broccoli cruciferous?
Yes. So it could be broccoli, it can be cauliflower, it can be kale, or Brussels sprouts. None of these things sound good, by the way. I don't know why. But cruciferous vegetables has one of the best sources of an antioxidant called sulforaphane. I'm going to type it out for you guys. It's the name of the antioxidant.
Doctor, where do I find what you're typing?
Oh, you got to open up your chat box.
Chat box.
Yeah, find where it says chat box. Okay, cruciferous vegetable. Did you find it?
Yeah. Oh, I see. Okay.
All right. So cruciferous vegetable, high source of anti-inflammatories with that. Okay. Next one, guys, is avocados. Avocados has a lot of potassium, magnesium, fiber as well. There. All right. Can you hear me better now, or am I still choppy? Okay. So
I'm on chat, but I still don't see what you're typing. Where do I find that?
The chat box?
Yeah, I clicked chat box, but I don't see any. It's blank now on the right.
Oh, I'm not sure.
No.
But email me later. I'll send it to you.
Okay. Thank you.
You're welcome. Next, guys, very important. More data coming out on this green tea. Green tea has a substance with a very long name. I'm going to give you the short version of it. EGCG. And it stands for epigallocaltechin 3-gallate. You don't have to remember EGCG. That is a strong anti-inflammatory property. Green tea has been studied to lower the risk of heart disease, cancer, Alzheimer's, and it basically inhibits cytokine production. Remember how we talked about the cytokine storm, right? That COVID causes? Green tea blocks cytokine production, guys. Next one.
I started drinking two cups of green tea a day, and it bothered my stomach. You can drink too much, huh?
Yeah, if you can't tolerate, don't do too much. Does green tea affect anticoagulation? A little bit, but not a lot that I know of.
So how much is a good amount? A cup a day?
Maybe a cup a day. Yes.
Okay.
How do you make green tea taste good? Good question. I don't know. What do you guys do?
I just drink it straight.
Add honey. Got it. Let me mute everyone here. So somebody said add honey. So I guess that's how you do it. I have no clue how to make green tea taste good. Honey and lemon? Oh, that sounds yummy. Okay. Awesome. Next one, guys, is ginger. All right. We should start like like a recipe club here. Next one is pepper. Chili pepper, guys. Chili pepper and bell pepper is rich in a number of ingredients that has a lot of antioxidants. One ingredient is called quercetin. Another one is ferulic acid, synaptic acid. They're all antioxidants, and they all have strong anti-inflammatory effects. Bell peppers also have a lot of vitamin C as well with that. Red and orange pepper is also good with that. Okay, so peppers is next on the list. Do you eat it raw or cook? Which one is better? You know, I have done both with it. I've eaten it raw. As a matter of fact, I ate some pepper tonight from my garden, some red peppers with dinner, and it did not taste spicy at all. It was very disappointing. But I think raw or cooked, you'll have the good value with that. Either way, the fact that you eat it is what counts. Next, guys, is mushroom. Mushroom. Now, not every mushroom is edible, okay? There are some mushrooms that make you look kind of loopy, maybe that's in the 60s or 70s, people have done that. But the mushroom in general, there's one called lion's mane that has some research behind it in reducing a lot of inflammation. But mushrooms, you can eat them raw or lightly cooked to reap their full, anti-inflammatory potential. Mushroom has a lot of seleniums, has a lot of copper and B vitamins and all that. Portobello mushroom is good as well. Yes, mushroom has a lot of zinc. Good stuff with that. Next one after that is grapes. Grapes. Reishi mushroom. Love it. Grapes, there's a compound in grapes that is a very strong antioxidant. Does anyone know what that compound is? Type it in the chat box if you know what compound it is that makes grapes healthy. You guys are good. Yes, resveratrol. There's resveratrol, resveratrol, and resveratrol. That's right. The dark grapes, either the black ones or red ones, it's on the skin of the grape actually is where resveratrol is at. Super important. I'm a fan of that. Does wine count? Does wine count? There are studies that a glass of red wine can be beneficial for your health because it's part of the Mediterranean diet. Raisins, yeah, raisins is full of iron. Wine count, but only 1 glass a day, right? I mean, you can't drink 5 glasses and get 5 times the benefit. 1 glass a day. And the glass, guys, is not this size. Okay, maybe down to about 4 ounces or something like that. So red wine does count. And you can't save all your glasses till Saturday. It doesn't work that way. Okay, you can't save all your glasses and drink them all on Saturday with that. All right, guys, next on my list is turmeric. Turmeric. I'm sure everybody knows turmeric by now, right? So turmeric has a compound called curcumin, and this is in Indian spice, right? That yellow Indian spicy, what do you call that? Indian, what do you call that, Squash? What's that flavor on Indian food?
Curry.
Oh yeah, curry. That's what I wanted to say. That's right. Yes, it's curry. I'm sorry, my memory is bad these days with that. So turmeric is curcumin. If you eat turmeric and if you want better absorption, add some black pepper to it. Black pepper helps with turmeric absorption. Okay, black pepper helps with turmeric absorption with that. So turmeric will lower inflammation from arthritis, diabetes with that. So how much do you take? The recommendation for turmeric for health is 400 milligrams a day. 400 milligrams a day is the dosage, guys, for that. How do you make it bioavailable without the pepper? You just eat more of it. Next one, guys, is olive oil. Extra virgin olive oil. Extra virgin olive oil is on the list. Okay, olive oil is part of the anti-inflammatory diet, which is the Mediterranean diet. And it's been shown to reduce heart disease. It's been shown to help with Alzheimer's risk reduction and things of that sort. Okay, eat the black pepper. Yes, you eat it with the black pepper. Olives is good too, but I don't know if you get the same amount, how much olives you have to eat to get the same quantity of health for olive oil with that. Cold press, yes, extra virgin olive oil. Next one is my favorite. Actually, next one is my favorite. Dark chocolate. How many of you guys that's your favorite as well? How many of you guys that's your favorite as well? I knew it. I knew there are chocolate lovers in here, right? Dark chocolate. Now, it doesn't mean you eat a ton of it every day. I'm not sure if that's healthy, but dark chocolate has cacao. Lalaine just ate Godiva. Oh my gosh. Jenica, yes, it's late. I know you're on the East Coast. Chat with you later. Time to put the kids to bed. Elaine says, I like milk chocolate. Yeah, the darker, the better. The higher percentage of cacao, the better. To get the health benefit, it needs to be at least over 70% cacao is what I recommend. Over 70% cacao. It has a strong anti-inflammatory effect. Next one, guys, is tomatoes. Tomatoes is a good source of lycopenes. Good source of lycopenes, which reduces inflammation. Lycopenes have been shown to protect against certain types of cancers as well. Lots of potassium, lots of vitamin C in tomatoes with that. And lastly, number 13, guys. Yeah, I love tomatoes. We have tomatoes in our garden, like the little cherry tomatoes, and they grow like weed. It's like you don't do anything to it, and they just keep, you eat it all, and next week there's a whole bunch more. They grow like weed, right? I mean, they're right next to my weed plant, and my weed plant doesn't grow as fast as tomatoes does with that, the THC plant. But yes, the tomatoes, love it.
Does tomato sauce count?
Tomato sauce, it kind of counts. It's the only thing is they add a lot of sugar in tomato sauce with that. Last, guys, number 13 is cherries. Cherries. Cherries is rich in antioxidants, anthocyanins, catechins, sweet cherries, tart cherries, all good with antioxidants with that. Okay, cherries, super good. Dark chocolate with cherries on top is what Vicky says. Perfect. Vicky knows how to eat well and healthy. Canned one's okay. Cans okay. I like things, more fresh than that. German chocolate cake. Oh, yum. Pineapple with a question mark. Yeah, pineapple's got some health benefits. So these are the 13 things, guys. 13 foods that will lower inflammation. And by lowering inflammation, right, you help to lower all types of chronic diseases. You help to lower all types of chronic diseases with that. Oh, Lynn wrote down 14. Really? I thought I only had 13. So I wanted to give you guys that as some useful tips on what to eat, what not. Oh, Donna has 14 also. Okay. Well, I gave you guys a bonus then. Whatever that extra bonus was, I have no clue with that. Ginger is good. Ginger is good. Anti-inflammatory properties, antiviral properties, things of that sort. So garlic is good as well. I mean, there's things that I've not talked about, guys. I wanted to give you the 13 that does have a lot of research behind it overall with that. Now, I'm sure we can go for another hour because I have so much more things I want to talk to you about, but this lecture is for an hour. How many of you guys want to talk about some more next week sometimes? You guys good with that? Because I want to show you more clinical studies next week that are really relevant. Have you heard of post-COVID symptoms? Have you heard of patients who are like, I've had COVID last month. Why am I still feeling weak and tired? Why am I still short of breath? Have you heard about the young kids who are getting strokes from COVID? Or folks who are getting brain fog from COVID? All right, Isabel says, yes, I've been reading research studies at UCI. Yes. Let's talk about all that next week, okay? I'm gonna pull up clinical trials that we're gonna talk about next week that deals with all these other, COVID symptoms and heart attacks and blood clots and everything else that's related with COVID that we did not have enough time to talk about with today. Let's do that. Let me look at my calendar. Let's see when's a good time next week here with that. Are you guys good with either, I don't know, next Thursday or next Friday evening, same time, about 6 p.m.?
Yes.
You guys good with that? We can do next, yeah? If most of you guys are good with either next Thursday or next Friday, we'll just pick, a date. Let me see here. Oh, okay. Well, I can't do next Thursday because I'm speaking next Thursday at the Laguna Woods Nutrition Club. So let's do next Friday then, okay? Put on your calendar next Friday. Same Zoom link. That way we don't forget the Zoom link. Same Zoom link next Friday, same time. And we'll go on and I'll share some more information that we didn't have a chance to today. Cool. Did you guys learn something today?
Yes.
Viral load, right?
Yes.
Viral load. Yes. Super important. Inflammation and viral load and how to lower inflammation with nutrition with that. Very cool. So I will chat with you guys next Friday, same bat time, same Zoom link. I'll send you an email and I'll put this all on YouTube and I'll send you a YouTube link as well. So let me go and stop the record.